Edutainment Studios welcomes you to Overactive Bladder, Helping with Relief. This module is part 1 of a 3-part series on the overactive bladder. An overactive bladder causes you to feel a sudden urge to urinate. The urge may be difficult to stop, and overactive bladder may lead to involuntary loss of urine. If you have an overactive bladder, you may feel embarrassed, isolate yourself, or limit your work and social life. The good news is that a brief evaluation can determine whether there is a specific cause for your overactive bladder symptoms. Management of an overactive bladder often begins with behavioral strategies, such as fluid schedules, timed voiding, and bladder-holding techniques using their pelvic floor musculature. If these initial efforts do not help enough with their overactive bladder symptoms, medications are also available. In this course, the objective is to help you learn the basic information about an overactive bladder, what the symptoms of an overactive bladder are. When you have an overactive bladder, your bladder muscles contract too soon. This gives you a strong, sudden need to urinate, even when your bladder is not full. You also may have urinary incontinence. This means you leak urine after you have a sudden urge. A healthy bladder that is full has nerves that send a signal to urinate. Your bladder's muscles work together to hold urine until it is ready to be released. With an overactive bladder, your bladder muscles contract when your bladder is still full. You experience a sudden urge to go. Nerves signal that your bladder is full too soon. Urine may leak out, especially if your muscles are weak. Common symptoms of an overactive bladder are a sudden urge to urinate that is difficult to control, an accidental loss of urine immediately following an urgent need to go, the need to urinate frequently, usually 8 or more times within a 24-hour period, not making it to the bathroom in time, the need to urinate 2 or more times a night. Use a tracker to record your symptoms when you have them and if anything triggers them. Do not feel embarrassed about sharing symptoms with your doctor. He can only help if you tell him what you are experiencing. Your risk of an overactive bladder increases if you are older. Risk goes up as you age, but overactive bladder is not a normal part of aging that you have to live with. If you have nerve damage from an injury or other health conditions like diabetes, stroke, Parkinson's disease, or multiple sclerosis. If you are taking certain medicines like diuretics for high blood pressure. If you drink too much alcohol or too many drinks with caffeine. If you are constipated. If you smoke. If you have gone through menopause as a woman. If you have a prostate condition as a man. Other health conditions, including urinary tract infections and enlarged prostate in men, can have symptoms that are similar to overactive bladder. Your doctor can help you find out what is causing your bladder symptoms. Please feel free to investigate these other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 1 of this 3-part series on the overactive bladder, and come back for part 2.